quorum with myself, council members Benton, Bradford, Huffman, Nash, Prepty, and Weiner. Oh, and we have council member Gregg. So we are at super quorum now since he's walking in. Before we get started, I am going to have a presentation first. And before I do that, though, I want to recognize that we have some guests in the back from our sister cities of Mendoza, Argentina. So we have some students here from Mendoza, and so you're welcome to stand up so we can all see who you are. All right, welcome. Thank you for traveling all this way. I hope you enjoy Nashville, and your hosts, Sarah Lingo and Mina Johnson, former council member Mina Johnson. And so thank you all for bringing them to our committee today. So we will go ahead and get started first with our presentation. We're going to hear from Box 55 today, and to introduce them, I've got our soon-to-be newly promoted as of tomorrow District Chief Young to come and introduce them to the group.
Thank you, Chair Lady. Council members, with us today is an organization that's been here for a while, and you'll hear that in a few minutes. For a while, I mean a long time. But anyways, this organization is 100% volunteers to the city, and not only to the fire department. They are there for the police department, the water department, anybody in the city. They'll show up if we're in a situation where we're at a extended stay for a while on a fire or whatever it could be, the floods or whatever it is, they're there. But they strictly run this on a volunteer basis and donations. And one way that they're funded is with myself a few years ago, and past president, Chief Dozier, council member, that was the president of Box 55 for a long time. We set something up that is payroll deducted. So the employees of the fire department actually have deductions on their payroll to fund the organization. But anyways, Chair Lady, thank you for having them, and council members, listen to this, and I think it'll touch your hearts like it has ours for many years. Thank you.
Thank you, District Chief Young, for coming and bringing the Box 55 group. And so with that, I'll turn it over to all of you, and the green light means your microphone is on. And so I don't know who is starting, but we can make sure that your microphones work.
Who is our vice president. I have Chris Neighbors, who's our treasurer, and Eddie Carter, one of our members. A number of folks are present. Chief Dozier, as Mark said. I gave you a handout there. We're not going to read it word for word, but I want to make some remarks here about some significant things. This group was founded in 1952, a long time ago. Chief John Ragsdale and Mayor Ben West. We have been a longtime 501c3 nonprofit. We currently have about 40 volunteers. Our role is to provide rehab services to all first responders, primarily for Davidson County, but also on request, we will serve area counties on a mutual aid basis, just like the Metro Police Department and the Nashville Fire Department would do. Chief Dozier also, one of his stints as a councilman, passed Resolution 088-466 in 1988, officially recognizing us and making what I call a quasi part of the Metro government. So we have been an official part of the government organization since 1988. The next page over is just kind of a nice historical shot. In 1952, this was a city bus formerly that the mayor and the fire chief converted to service. On the third page, what do we do and why do we do it? So all first responders are subject to heat exhaustion, extreme stress. There is a very high incidence of strokes, heart attacks, and also, unfortunately, cancer, from an exposure. And so in addition to that, NFPA, National Fire Protection Association, Standard 1584 mandates that firemen receive rehab services. Well, what is rehab? Rehab means they have to come out in a period of time. Usually it's after taking down 2 air bottles on a fire, and they have to receive hydration. They have to get their heart rate down, have to have their blood pressure taken. So Box 55 is paired with EMS on scenes. They're doing the medical side of it. We're doing the other side of it, where we're taking care of them in terms of their body temperature, the heat exposure, chairs to sit in, tents to sit in, that sort of thing. When they complete an assignment, or they're completing an assignment, we have special packaged wipes that have anti-carcinogen material, and they use those to clean their hands and clean their face. There's other things they do as well, but the exposure to carcinogens is huge. And so we do a big part in helping reduce that risk. In 2024, to give you an idea, we served or provided 382 responses to incidents. Majority of those were fire, but it also was police, OEM, water department, NDOT, those kinds of things. On the next page is kind of a review of all the types of incidents we would cover. Certainly fires of any kind, hazmat situations. Unfortunately, we still have lots of very serious motor vehicle accidents, some with fatalities, some not. There's extended extrications. Chief Drake and his team uses us very frequently on SWAT and hostage negotiator situations, also active shooter situations. One that would be remembered by most everyone is the bombing of 2020. In 2020, we were on scene for 14 days, 24/7 for 14 days. We served over 5,000 meals with assistance, but we were there. We rehabbed those folks, again, 16, 18 hours a day for those 14 days. And so those are the kinds of things that, the average citizen probably isn't aware of and doesn't know, but that's some of the things. Tornadoes, floods, and other things, drownings, body recoveries. We're there for all those kinds of things. What are the next page? Key components of what makes it work. Well, volunteers is number one. You can have all the vehicles and all the buildings and all the stuff, but it's people that really are the key to our organization. So we have a system by which we recruit and select. We do background checks, we do interviews, we do training. Just because somebody calls and says, I want to be a member of Box 55, they are not necessarily selected to be a member. Randy handles a lot of that, but we are very serious about having good folks because we are a reflection of the fire department, the police department, this city, this council, and all those. So people, we'll talk a little bit about our vehicles. On our vehicles, we're carrying water, Gatorade, light snacks. In the summer, it's misting fans and things to cool them down. In the winter, it's portable heaters to warm folks up. We have chairs and tents so that if it's an environment of, again, extreme sun or rain or snow or whatever, we're trying to get the first responders out of that bad weather. When we are on scene for an extended period of time, both police and fire will request us to provide meals. We then reach out to whether it's McDonald's, Chick-fil-A, whoever, and we partner with them on providing box lunches, box meals, pizzas, whatever, to make sure they have the nutritional calories and things to recover from what they've spent. The next page shows just the current vehicles we have. It's a 2016 and a 2020 Freightliner Sprinter van. Our group has bought these as just plain vans, and then we've worked with a number of community individuals to have them outfitted with all the necessary equipment and things to do our service. We drive a lot of miles. Maintenance costs are high. Maintenance, or the cost of new vehicles, is expensive. The rest of this are pictures of scenes of service. So I won't go through each one of those, but let me pause now. Chip, any other things from you that I'm missing? Randy? So I would just love to have questions from you all as to what we do, why we do it, that sort of thing, whatever's helpful. Yes, sir.
Here you go, Councilmember Huffman, you're recognized.
Thank you, Chair, and thanks everybody for coming. The benefit that you guys have, it definitely far out exceeds your presentation. Really appreciate what y'all do. My question is more for you, and that is in the form of what can we do for you? You do so much for the city. You know, what can we do to be helpful?
So let me make a statement and I'll answer that question. There are, first of all, back to that NFPA standard, this must be provided. This is not an optional thing. The Metro government has to provide this service. If the department or departments were to go hire people, buy vehicles and do all these things, it's a big cost ticket. We don't ever want that to happen. All that said, it is expensive to run our organization. We are, as Mark said, we're very thankful that the fire department does payroll deduction. We receive a small check each month from the police union. Unfortunate to say, the bombing put us on the map a little bit with citizens. There's a number of folks who give us $10, $15, $20 a month, okay? What really we are in need of is we need a building. We need a home base. Fire Station 7 in West Nashville, Fire Station 38 on the Madison side have graciously allowed us to store some things there. They're getting more staff, they're getting more equipment, you know, they're very gracious. But as an organization, as I said, our people are our heartbeat. We need a place to call home. We need a place to put up some awards and things that we've received over the years. It's just like any other organization. You need some place to have some pride and things. So what we would like to see is council to work with the folks that are in the building department. We've had one conversation. We have to believe there's a vacant building somewhere that could be great for us. The needs are for a couple of garage-type bays that would store a smaller Sprinter van, not a fire truck. Room for a couple of pallets of water and Gatorade. Our preference would be that it had a meeting room that would accommodate 40 or 50 people. We don't want offices. We don't need offices. Nobody's trying to build a hierarchy or a fiefdom or any of those kinds of things. The awards and pictures and various things we have would go on the walls of the meeting room is at least the vision that we have. And, you know, there are numerous organizations like us around the country that cities have given an old fire station or they found a building and done a economical lease, you know, whatever could be worked out. But there is a little bit of a precedent been set by other cities that this is not a crazy thing to ask for. Does that answer the question?
That does. Thank you, sir. Appreciate you.
Okay.
Councilmember Weiner, you are recognized.
Thank you so much, Chair, and thank you guys for being here. I've had personal one-on-one engagement with Box 55 out in Bellevue, and the work that you all do is incredible, and I don't think that there are words that adequately express what you guys mean to this community. That said, have y'all considered any future-looking strategies or plans for what you think the future might hold for Box 55 in terms of additional things that you may want to be able to offer or additional needs that you may have beyond or in conjunction with this particular facility need?
Let me say a couple things about that. First of all, we also formed an organization called Middle Tennessee Rehab Alliance. Off of Box 55, there are about 8 counties that surround Nashville that have developed rehab groups similar to us to address those counties' needs. We have relationships with them where Nashville's in trouble, Wilson County's coming to help. If Wilson County's in trouble, we're going to go help them, et cetera. The whole science of rehab continues to evolve. So there will be increased technology in terms of cooling, heating, medical monitoring, those kinds of things. And we see it being broad in that it could be any city department that is in the field. But it does take resources to do that.
The reason I ask that is if we're looking towards a facility, we don't want to build you into obsolescence.
Absolutely.
And additionally, in terms of number of vehicles and equipment needs.
Yep.
I think it would be helpful if you could share with the council at some date what that futuristic picture looks like so that we could make sure that whatever planning we're able to facilitate, we can do comprehensively.
Sure. So again, right now we operate 2 vehicles. We actually have a 3rd vehicle that's on order. We need 2 vehicles on the street all the time. And it's a little bit like any other fleet. If you got 2 on the road, you got to have something to put in the shop and do maintenance and repairs and those kinds of things. And a half a dozen times a year, they're all 3 going to be running the wheels off, and you really wish you had 6 vehicles. But, back to planning and budgeting, that's not necessarily able to be done. So 3 for the foreseeable future of the next 3 to 5 years would be what we see. In the long term, sure, it would be great to think about something far east, something west, something central, that sort of thing. But we fortunately have our volunteers spread a lot throughout the entire county. And so even though the vehicle may be responding from one central point, volunteers respond straight to scenes and are equipped with enough things, they start providing service even until the vehicle gets there, in a personal vehicle.
My last question, and I'll let somebody else have the floor. How many volunteers do you have and how many people are active on average
Sure.
in the different scenes?
So we have about 40 members on our roll. I'll be honest, it's like a lot of other volunteer organizations. You got 40 people on the roll, but maybe 20 or 25 are really the folks that are carrying the ball and doing the work. That is the way it is. Now, those other people may not be making scene responses, but they do help with fundraising and they do a number of things that serve a function. But we currently have adequate people to do the responses. We just don't miss a call. It's 24/7, 365, and our relationships with Chief Swan, Chief Drake, and everybody else, OEM, they're solid. And we work together very well, and we just don't miss calls.
Well, thank you. We can't thank you enough for everything you do.
Thank
Chair.
you.
Thank you. Let's see, let's go to Councilmember Benton.
Thank you, Chair. I'm just curious as how many will typically respond to any particular call? We've got the 2 Sprinter vans. Are they just loaded up with all kinds of folks, or is it just 1 or 2 in each one?
Yeah, so the first van is what we would call a take-home unit. Whoever is on primary call, that goes home with them to their home. They're going to respond by themselves, and the other responders come in their private vehicle, not lights and siren, normal within the law responses. And on average, anywhere from 2 to 4 people on a normal house fire or commercial fire. If it's a 2-alarm, a 3-alarm, or whatever, we could end up with an almost unlimited number of people. There's several ways we communicate. We are hooked directly to the CAD from dispatch and receive pages and notifications. We are assigned radios from the fire department and can communicate directly. So it depends on the level of incident and the time of the response. And Chip, again, that's one of his areas of specialty. We actually can communicate and make sure if we need more or we need less, we send what's needed and make sure it's covered.
So it's mostly they're answering a call from home.
Correct.
Okay.
Correct.
Thank you.
Councilmember Nash.
Thank you, Madam Chairman. As a former first responder, I certainly want to second everything we've heard here tonight. Thank you for all the work you do. It's very important. Typically, if you have to set up a tent to protect folks from our weather, how many people are you having in it? And I only ask because I wonder if a camper might be appropriate to think about going forward where you could, but if you got 20 people, who might not be able to do that. But if it's 5, 6, 7, where you could have something that's already set up.
So we carry 2 tents on each vehicle. They're both 10 by 10 tents. So depending upon whether you're standing or sitting or whatever, you can get 15, 20 people under there in terms of whether it's you're shading them or getting them out of the water or whatever. We've been on a number of long-term incidents where either PD brought their large blow-up custom tents or OEM has brought large blow-up custom tents. So at this time, we don't see the need for us to do that because usually it's a multi-department deployment and those resources are already in existence.
Super, good to hear. Thank you so much.
All right, let's see. Are there any other questions? I think one of the questions that I had in hearing your presentation and having been to some of your events and that kind of thing is like, what do you look for? What are the qualities in volunteers that you're really looking for? And like, is there a certain kind of background? Because obviously you all are very knowledgeable about fire and equipment and everything else. So can you kind of share more about that?
There's really no experience needed.
Do you want to get on the microphone? Oh, you got to turn and hit the button down there. Maybe. Maybe not.
Okay.
There we go.
There's really no experience needed. As far as what we're looking for folks that can handle the elements. The elements are obviously, as Rick said, we could be out there for 4 or 6 hours on our feet, up and down hills, especially in some of the apartment complexes where we're usually one of the last ones on the scene, so we're way at the back. So the requirements are more physical than anything, of just being able to walk, stand, carry, those kinds of things. But once we typically get there and get things set up, we alternate who goes back and forth to the van. So that's how we do that. We do all our training ourselves. So you don't have to come with any fire experience, any of that. We obviously just want, good people that can, see a need and take care of that need. And that's really what we train on. It's not how to hand out a bottle of water. It's what to look for. We help the medics look for maybe a firefighter that's struggling with breathing or dehydration or just something that looks abnormal, and that's what we're looking for. So we're looking for any volunteers that can do that. I mean, just, and then we train from there. So that's, yeah.
And I would just make one more comment about that. We're looking for people, when they come to us, that their motives are pure as to why they're looking to be here. If you're looking to chase red lights and sirens, that's not what it's for. So Randy handles that and interview questions and a variety of things that we just make sure somebody's motives are pure as to why they're part of this.
Okay, thank you. That helps, I think, for folks to know they don't have to come with any special
Correct.
qualifications or understanding.
serve.
Yeah, that's awesome. I love that. And whoever thought of the payroll deduction, that's also a really great idea. So I'm glad that that was something that Fire was able to implement.
Chief Mark Young gets the credit.
There you go. Any other questions for our Box 55 team? We've got some other Box 55 folks kind of in the gallery, and thank you so much for being here today and for your service as well. With that, I appreciate your time and thank you so much for coming and sharing with us, and we'll transition to our legislative agenda now.
Thank you all very
All right.
much.
All right. For our agenda today, we've added Councilmember Kimbrough. So we have 9 folks in attendance. I'll go ahead and read the item numbers of what I have on a proposed consent agenda. And then if there's anybody who would like anything removed, I can take something off for you. So the potential consent agenda is item number 1, RS 2025-1144. And then I have item number 2, RS 2025-1145. Item number 3, RS 2025-1148. Number 4, 1152. 1154. And then BL 2025-782. Does anybody need any of those items pulled from the consent agenda? Okay, I'm not seeing anybody who wants anything pulled, so I'll go ahead and read them, and then I can revisit that in case anybody changes their mind. First item is RS 2025-1144, a resolution accepting a Summer Jobs Connect grant from the Cities for Financial Empowerment Fund, Incorporated, the CFE Fund, to the Metropolitan Government, acting by and through the Metro Action Commission to implement a comprehensive financial empowerment program that provides participants with access to safe bank or credit union products. Item number 2, RS 2025-1145, a resolution to appropriate grant funds from the Martha O'Brien Center's Tennessee Opportunity Pilot Initiative Implementation Grant to the Metropolitan Government, acting by and through the Metropolitan Action Commission to formalize the parties' relationship while collaborating on direct services, capacity building, collaborative activities, and grant compliance. Item number 3, RS 2025-1148, a resolution appropriating a total of $110,000 from a certain account of the Community Safety Fund for a grant to Nashville Anti-Human Trafficking Coalition to provide services that support victims of sex trafficking through rescues, assessments, intervention, addiction, and trauma recovery. Item number 4, RS 2025-1152, a resolution accepting an emergency management performance grant from the Tennessee Emergency Management Agency to the Metropolitan Government, acting by and through the Office of Emergency Management to subsidize the emergency management program. Item number 6, RS 2025-1154, a resolution approving an application for a Project Safe Neighborhoods grant from the Tennessee Department of Finance and Administration, Office of Criminal Justice Programs to the Metropolitan Government, acting by and through the Metropolitan Nashville Police Department to reduce gun-related violence in Nashville by providing funding for overtime for the investigation of violent crimes involving guns. And then on bills on second reading, BL 2025-782, an ordinance to provide for the designation of public property within specified areas of downtown Nashville as a temporary special event zone during the time period beginning at 6:00 a.m. on June 4th, 2025, and ending at midnight on June 9th, 2025, relative to the use of these areas in conjunction with the 2025 CMA Fest and related activities and events. Do I have a motion? Okay, it's been moved and properly seconded. All those in favor of the consent agenda? Anyone opposed? Anyone not voting? All right, then we will be recording recommendation for approval of those items, 9 in favor, 0 against, and 0 not voting. And then we will transition right on time to, after the consent agenda, to item number RS 2025. Oh, I'm sorry. This is your next in line, so I got a little excited. I thought you had timed that perfectly. RS 2025-1153 is a resolution approving an amendment to a contract between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Nashville Police Department and the Mental Health Cooperative Clinical Personnel. That item has been withdrawn in budget. And then oh yeah, sure, we can do that. Do I have a motion to withdraw? All right, very good. All those in favor of withdrawing? All right, thank you. Let's move to item number 7, RS 2025-1168, a resolution identifying the skills and qualities needed for the next Chief Operating Officer of Nashville General Hospital. Sponsors Toombs, Ellis, Gadd, Swara, and Porterfield. Do we have a motion? It's been moved and properly seconded. I can recognize the sponsor. Chair Porterfield, you're recognized.
Thank you so very much, Chair. I just wanted to stand in support of this resolution and ask our colleagues to support. We did something similar when we were looking for the director for the health department. This is a little bit different in that for that position, the board was able to go through the process, identify someone, and it came back to council for us to vote. In this instance, the council doesn't have the opportunity to, vote on the person or opine. So it's even more important that we are able to say what it is that we would like to see in the next director of the hospital. It's really important that we do everything we can to repair the relationship between our government and the hospital and the community. There are so many of our constituents who use Metro General Hospital faithfully. Several council members use the hospital faithfully. And we just want to make sure that we're going forward with strong leadership that is, and through a process that is very transparent and a community-driven process. And if you look at the American College of Healthcare Executives, they have suggestions for hospital CEOs, and in the recommendation is that the CEOs are visionary and have visionary and adaptive leadership, the ability to build loyalty and trust, self-mastery, strategic thinking, strategic scanning, and masterful execution. So this legislation is just recommending that we use these best practices and looking for our next director. And with that, I ask that our colleagues support.
Thank you, Chair. Any discussion on this item? Council member or Chair Rep T? You're recognized.
Thank you, Madam Chair, and thank you to the Budget Chair for speaking in favor of this. I also rise in favor of this resolution. One of the things that I've spoken about frequently is this trust and strength in our institutions. And so this specific resolution lays out what we need for this particular institution. Unfortunately, throughout the years, it's been an institution that's consistently been under attack. So I think ensuring that we have good principled leadership leading this institution that truly serves everybody in our community, I think is vital. So I rise in support of this resolution and appreciate all the sponsors on this resolution.
Thank you, Chair. Any other discussion on this item? Okay, I actually have a question, so I'll direct it to you, Chair Porterfield. On the, we went through the Board of Health conversation, like it was kind of shocking, like, oh, council's trying to influence this process. And so have you, do you know if the primary sponsor has had any feedback from like the authority or with any concerns? I think the way it's drafted, there should not be any concerns, but just wanted to check that box since it was a concern with mine. Oh, sorry. Let me recognize you. There you go.
Due to the Tennessee Open Meetings Act, I do not know if the sponsor has had any communication. However, we can go ahead and pass this here, and the sponsor will be here for the meeting, and it could be addressed at that time.
Yeah, it wasn't going to sway my vote at all, but it was just more of a curiosity question because I do think it's something that we should probably just maybe ask on the floor. So thank you for that. So we'll go ahead and vote. All those in favor? Anyone opposed? Anyone not voting? All right, so we recommend approval, 10 in favor, 0 against, 0 not voting. Okay. Is April Calvin here? Oh, there you are. You're like kind of tucked over there and I didn't even, like I've said, well, it's like once I get past the podium, I can't tell who is who in this room. So I will, if y'all could come up. I asked Director Calvin and team to be able to share kind of an update. And if you wouldn't mind when you come up, would you introduce yourself to everybody? And before you do, I wanted to just say that Mr. Clendenning, who we've all historically had, come to the committee, he's leaving Metro and his last day is coming up on the 20th, I guess. And so we won't see him again. And so best wishes to Mr. Clendenning and I appreciate all his time coming in front of us and sharing information. So I will email him and say that, but just wanted to say that on the floor as well. And let me go ahead. Your podium is on. And so if you could introduce yourself, that'd be awesome.
Of course. My name is Allison Cantway, and I am with the Office of Homeless Services. Thank you so much for sharing that. I'm probably a poor substitute for Bill Clendenning, but he has been a wonderful staff member, and we definitely are gonna miss him, as I'm sure y'all will. But of course, we're here to share information about our $50 million ARPA and to answer any other questions that you may have. So everyone should have gotten a packet. As you can see in here, and I'll start with the report highlights on page 3. These are just some of the notable things that have happened. So, of course, we all know that this last month, there were many storms that affected lots of people here in Nashville. So we continue to monitor those storms. We have an emergency services manager who is constantly checking the weather on top of that to make sure we can do as much as we can to keep people safe. We're in partnership with Chief Swan at OEM. During these recent storms, we provided 58 bus passes. We provided 13 dispatched rides and performed safety checks at encampments to provide resources and keep folks safe. I will also note that the prioritization team has selected the next encampment for a housing surge, and they have selected the encampment on Anthony's Drive. Of course, the federal funding situation is always moving and always changing. We're continuing to coordinate, prepare, communicate, particularly with the local agencies that receive those dollars from HUD through the Continuum of Care program. We are meant to receive as a city $11.8 million this year. And so we're tracking that very closely. Award letters went out several weeks ago. Some agencies received contracts, and then those contracts were rescinded. I'm pleased to report that at least one local agency has gotten their real contract and has signed it and sent it back to HUD. So I think that's really encouraging. And we're keeping track of all the other local agencies here to see where they are in the process. Of course, as the collaborative applicant, we are facilitating these ongoing meetings with all of the local agencies that receive COC funding. There are 10 of them, so that they can collaborate with each other and we can all come up with contingency plans to make sure that even if there are interruptions with federal funding, that, there are still ways in which services can continue. We're also pleased to report that the hospitality hub of Memphis, they've got several staff members here in town and they are working really hard. They have ramped up their presence as they were established to serve the interim housing residents at 95 Wallace Road. So we're working with them. We're having meetings with them. I would say we're having 2 to 3 meetings with them every week and probably speaking to them every day. So we're in close contact with them, troubleshooting everything, answering any questions that they have and providing support to them so that they're well prepared to welcome the guests from the Anthony's Drive encampment. And I'm very pleased to say that they actually were able to house a few people last week. And so that process has gone really well and they're going to continue to take more folks week after week. So of course we'll bring updates here so that everybody's aware of sort of where we are with the process, but they've been wonderful partners. They came to Nashville, beforehand and met with a ton of local nonprofits, toured their buildings, met their staff just to establish that trust early on. And so I think they're doing very well so far. And then one last report highlight is that Shelby House, that's a development that received funding from the Affordable Housing Gap Financing Program. They received 2 allocations, $2.1 million and $712,544. They're processing concerns of addressing the needs of really 3 separate populations, those that are market rent, those that are abstinence-based for alcohol and drug considerations, and then for, the Housing First, which we know that Housing First is the model that really, really works well to make sure that folks that have experienced homelessness will stay in housing with ongoing supportive services. Now, of course, our presentation has lots and lots of numbers for you for, all of these different projects. I'm happy to address anything specifically if you have particular questions about certain programs in the packet.
We'll open it up for any questions related to the presentation information. Does anybody have anything they would like to have answered? Councilmember Weiner.
Thank you so much. You did a really good job.
I appreciate that.
I've just got a couple of brief questions. The Anthony's Drive encampment, how many people are in there?
It's about 120, is that right? Mm-hmm.
And let's see, the other question that I had was, how long do you think it's going to take to get that many people housed?
Yeah, the notice that was placed was a 60-day notice. But of course, we're really hoping that we'll be able to get folks housed even before that 60-day mark. We've got a lot of services down there. Our staff are down there several hours every business day. So we're hoping that we can go even faster than that.
What's the capacity at Wallace Road?
Oh, as far as vacant units, it's
can hold up.
it's far more than 120.
Is it?
Yeah, 122. There you go.
Okay. Are there any criteria for them being able to be in there? Is there abstinence or what's the percentage? If it's
No, like I said, we know that Housing First is really the model that works, which is that it's really, really hard to tell people you have to get a job or you have to, be fully abstinent. If you don't have a place to live, it's really difficult to do that. So Housing First is very, very low barrier. Let's get people into housing so that then we can help them work on those sorts of things.
perfect? Thank you.
Thank you.
Let me get Councilmember Huffman.
Thank you, Chair. A couple of my questions were answered by Councilmember Weiner. She beat me to it. One question that I did have that she didn't get to was related to the flooding at Anthony's Drive. Were any residents displaced due to any flooding issues that you were aware of?
I'm not aware of any.
Hi there, Director Calvin. They were not affected by the flooding. The higher level, I think, is the issue. It's kind of like a bowl where there's a lot of water that comes in. So a lot of them just moved back or moved out of where the water was ponding.
Got it. Thank you.
I'm going to get Chair Porterfield, and then there's a couple of non-committee members that have questions, and I'll go to them. So let me recognize Chair Porterfield.
Thank you, Chair. I just had a clarifying question. Councilmember Weiner asked about abstinence. Are we talking about abstaining from drugs and alcohol? Okay, I just wanted to make sure I wasn't clear on the form we were talking about. Thank you.
Thank you, Chair. Any other committee questions? Because then I'll go to some, Councilmember Prepty, let me grab you.
Thank you, Madam Chair. And my question is about some sort of wraparound supportive services, especially as like the weather, well, it's quite bipolar, but it was pretty hot yesterday, right? And so are there any additional resources like hydration resources to ensure like people who are and like cool down stations for folks who could potentially be suffering from heat stroke or severe dehydration? What's the current capacity for providing those supportive services?
Thank you for that question. We have an emergency services manager that watches and monitors the weather, along with working closely with the Office of Emergency Management. And there's certain triggers. Right now, as far as during the storms, we're just monitoring the storms and ensuring that, people have access to bus passes and places to go. I don't have the number in mind right now for when it would trigger for us to bring a hydration station or to work closer with Chief Swan at the Office of Emergency Management. But maybe typically that happens around June or July when the numbers are a little bit higher. Thank you.
All right, we'll go with Councilmember Coopin next, and then Welsh.
Thank you, Chair, for recognizing me, even though I'm not on the committee, and thank you to Office of Homeless Services for your work on the Anthony's Drive Old Tent City Camp. I know there's been a lot of moving parts and conversations, and I appreciate being part of it. And just want to let anybody in the public know that if people have questions, they can also reach out to me. I've been down at the camp a couple of times. I've been obviously in close contact with Director Calvin and her team and some of the outreach groups down there. So I just want to open that door for folks that may have questions or concerns. I know there are some folks down there with RVs or with multiple pets, and so we are working on making sure they get to a place that recognizes and honors what they've been living with and what their choices are. So just wanted to share that and share my appreciation. Thanks.
Thank you, Councilmember Coopin. Councilmember Welsh.
Thank you, Chair, for recognizing me, even though I'm not a member of the committee. I just would like to point out that I feel that it's very important that we use clarity in the language that we choose. We are calling this a housing surge, but it is not, in fact, a housing surge. A housing surge is actually new housing, and we are going to be housing the people from Old Tent City in beds that have actually stayed open for over a year. So that's not really a housing surge. We're actually putting people in temporary and temporary housing. And that is not really a housing surge. A housing surge is actually getting people into new housing and permanent housing. So I just think it's really important that we are very precise in our language because we're giving a false impression about what we're actually doing as we are housing people. Thank you.
Thank you, Councilmember Welsh. Let me go to Councilmember Nash.
Thank you, Madam Chairman. Is Mr. Clendenning going on a well-earned retirement, or has he got a new path to go on?
He was doing real estate prior to coming to our office and was going back into real estate as well.
Okay. The other question, and I don't know if it has to do with this presentation, but I know we've talked about those small houses often, and I thought we got over some of the humps of codes and fire and whatnot. Is there an issue now with just finding a place to put them, people that want to use them? Or
I'm sorry for interjecting. Do you mind if I give the update on that? Because I don't want to put anybody in a department in that position. So the long and the short of it is, we had the most beautiful project team in the history of project teams going along to meet a goal to be able to issue the RFP on those pallet shelters. Anyway, the issue has been that the two primary leaders of our team were really doing a lot of the work, kind of interacting with the state, because the shelters were built or were bought, with state, grant money. And so we were really making sure, that we were not running afoul of the grant process at all. So whenever the CDC cuts happened at the federal level, those cuts impacted the health department. The health department lost positions. Two of the positions they lost were the two people that were leading the project. We were about a week out from being able to have like an announcement about, here's when the RFP is going to go out. So that's the negative side. So for all the people that question whether or not there was a local impact to Nashville from the CDC cuts, there was a material impact, impacted this project. I'm not in my feelings about it today like I was when I first learned. So as a result of that, we've been kind of in a little regrouping mode, and I'm very grateful to the Office of Homeless Services, who is stepping into that position of kind of leading us to get through, to the RFP. And so we have a regroup meeting this week, and then we'll probably have a better idea of like where we're headed. But that's kind of been the outcome of it, why you haven't heard a little bit more about it.
Thank you. That's a great explanation. The RFP, what do you think, what are the primary goal of the RFP?
It's really so basically as part of the team, we were working with the pallet shelter manufacturing company and kind of all their best practices around the country related to all the cities who have had these shelters available and the processes they went through. And so the RFP in particular is kind of laying out here's all the parameters that if you're interested as an organization of taking some of these on, what you'll need to be submitting, can you accommodate, like from a security perspective and, some of those details. So it was really kind of laying the groundwork for like what that looks like. And so there'll be an interest meeting, as soon as that we're ready to roll for providers and organizations to be able to hear kind of like, this is what it's going to look like. Is this something you want to apply for?
Thank you. And thank you both and all your team. It's a tough job. Appreciate the work.
Thank you. Thank
Yeah.
you.
How about, and I'm sorry, I derailed your question, I think, because you were talking about the shelters, but then did you also have anything else you needed to ask? No. Oh, okay. How about any other questions I'm sorry. I'm sorry, Mr. Benton. Let me recognize you. Thank you.
Appreciate it. So, thank you for your work too.
Thank you.
I see some absolute numbers here, and I think 3,570 was our grand total currently. Is that correct?
Which page are you on?
It's on page 21, just for our homeless population, basically.
Yes, it's last month's HMIS report. Mhm.
So how are we doing year over year? Are we trending down or up, or how is that number going?
Thank you for asking. So we're pulling some reports. On June 4th, we're going to have a forum. And so we're going to have some really great numbers on year after year, the last 5 years of what that looks like. It's kind of trending the same because what we know is as we're housing people, there's some prevention and diversion work that needs to happen on the front end to prevent people from going into homelessness. So I think in looking at our data, the good thing is we're not going like in other cities and states, the national average was an increase of 18% last year of homelessness. And locally, we only had like a 2% increase. So I think we're doing better than national average, but could be doing a lot better as a community as well.
Okay, thank you.
Thank you, Councilmember Benton. Any other questions for the Office of Homeless Services? Okay. I appreciate your update. Are there any other departments? District Chief Young, I had asked if you wouldn't mind sharing about the declaration for folks that don't read their emails.
Yeah, thank you, Chair. I hope, council members, I hope you're receiving the emails. I've sent a couple out, and Chief Swan is going to make sure that I keep everyone updated on the declaration, where we're at with that. It looks like we have reached the threshold of the dollar amount to get some funding. And now what will happen is, as the other counties get their documents in, the state sends that up to the federal government, and then we will start receiving some funds. And some agencies from TEMA and FEMA will be here on the ground and be watching for these emails, because if you have someone in your district that was affected by the recent storms that may need some assistance. This will be very helpful to making sure they get to see the representatives to get what they need. So I would say another update will probably be in the next couple of days. But just to let you know, we are qualified for the declaration.
I'm going to recognize Councilmember Prep-T.
Thank you, Madam Chair. My question is specifically for constituents who were affected, because in Green Hills and Oak Hill, we had some pretty severe flooding. In preparation for TEMA and FEMA doing their assessments and making sure that people are rightfully allocated the resources that they need, what do average Nashvillians need to keep in mind? What do they need to do? And what do they need to provide whenever these assessments are being made?
Well, I think the best thing to do is to make sure that if anybody contacts you, make sure that they are in contact with the representatives. The representatives will most likely come out on site and survey the damage, and then they will just take the estimated value from that point.
Thank you.
Yep.
Any other questions for District Chief Young? Okay, I do not see any. Thank you for updating everybody with that. I don't see any other department heads that want to give an update, raising or running to the podium. So let me just recognize, I guess, a couple things from my vantage point. It's Animal Control Officer Week with Metro Animal Control. So if you see one of them out, please let them know how much you appreciate them. It's also National Public Safety Telecommunicators Week. So thank you to our 911 operators and dispatchers and everybody that takes those calls at the front of the front line. And then the last thing I wanted to mention is, of course, we had a horrific murder at one of our elementary schools, and Miss Niurka Alfonso Acevedo was killed. And so just wanted to send our recognition and condolences to her family and friends. And it was a tragedy, and I know we had a lot of Metro responders on the scene, and I appreciate their support of the school and the students, and of course, her family. So with that, with no other questions for the committee, we will consider ourselves adjourned. Thank you.